Welcome to Lifetime Talks. I'm Jamie Martin, and I'm back with Jim LaValle for our special series on performance and longevity with MIORA. Jim, we have a really big topic to talk about in this episode. It's one we haven't actually covered on the podcast before at all, whether it's Lifetime Talks or in this series. We're talking about sexual health, drive, and performance and why they matter for health, right? So, it's so interesting. When people think about sexual health, they think it's about more than the performance, right, in the bedroom. It really reflects overall vitality, hormone balance, and even cardiovascular health, right? So we're going to dive into it. We're going to talk about some myths, and we're going to dive into things we can do to support our sexual health. And we'll get a little gender specific within this too, because that's really important.
No, that's great. Yeah, I mean, look, what's really interesting? If you look at all of the online telemedicine platforms, the majority of them are focusing in this area.
And why do you think that is? Is it just like that's an area of opportunity because so many people are struggling right now?
Yeah, I think people are in need.
Okay.
I think it's that straightforward. And there's good reason for that. So once you understand, well, why is there a shift in libido? Why is there a shift in feeling desirable? Well, you gain weight, your hormones have shifted. And, we've talked about this in other episodes of why do your hormones, your sex hormones in particular, shift. It's dependent on what your stress level's like. Where's your insulin levels at? You're chronically inflamed, so you're turning down your ability to make, hormones. And so all these things kind of play into, the picture, along with all the emotional wellness. We don't want to, minimize the, are you in a relationship that matters? Do you feel wanted and desirable? Right? So there's that layer as well. But there's some very physiologic things that start to happen, right? So when women lose hormones, for example, as they enter menopause, or if they're even perimenopause, they notice low sex drive. It could be strictly changes in estrogens, testosterone, which I know we'll get to that later about what the value is for that, and progesterone. But it could also be because they've been under stress. Maybe the limbic system has really become, basically supercharged with stress response, and they lose their oxytocin, which is a peptide hormone that your brain makes. Well, men and women make it, but I think in particular women even benefit or see the effect of it more for sexual desire.
Well, the way I've always thought about oxytocin, it's kind of like the bonding hormone. Like it creates that almost like, even though it's physiological, there's almost like an emotional component to it as well.
No, that's exactly it. That's why it's more important for women, right? Because, we can get into it, but I remember when I was talking to Marianne Legato, who was the head of gender-specific medicine at, I believe it was Columbia, and we were on an advisory board together, and she was talking about the difference in the MRIs of men's brains and women's brains. And first of all, women are actually more wired for fight or flight than men are. And that makes sense because, more women end up with needing anxiety meds and those kind of things because the nervous system is more ramped up. But more importantly, they did imaging for men and women after they, had sex. And what they found was with the men was that their dopamine, their reward centers lit up.
Okay.
So I got a reward.
Right.
For women, it was the emotional bond in the limbic system that lit up, which is that feeling secure.
Right, that sense of security and safety.
Security, safety, and bonding, right? So there is a difference, and that's why there's different compounds that can be utilized to help. It's just important to realize it still goes back to this basic construct that I know at Lifetime and MIORA at Lifetime is that you have to have foundational health. A good example, you mentioned cardiovascular disease, especially in men. When men start having trouble with erectile function, that is the first and earliest sign of heart disease. And I don't think men get that explained to them. What they end up thinking is, my testosterone's low. And I've been around enough of hormone replacement therapy in men that sometimes that is the answer and it works, but many times it's more about, are you getting that blood sugar under control? Are you exercising?
Yep.
Are you getting a good night's sleep? And in fact, Baylor School of Medicine, I remember being at a talk there, and they've done a lot of research in men, particularly on testosterone. They said, one of the researchers said, if a man's not going to exercise, eat better, and get good sleep, don't bother using testosterone. That's how important their research showed that lifestyle augmented and actually made testosterone more effective.
That's a huge thing to understand. And I think it goes back to something we've talked about over and over again in our various episodes, is like, it's all a system of systems, right? And
That's
so
right.
while we might be talking about sexual health here, it is connected to a larger health and well-being, and can be an indicator and be influenced by other systems in the body as well.
That's exactly it. Yeah. And so, well, what can we do about those things? Well, the obvious for insulin resistance, and if they're overweight, is to help someone to improve their weight loss. Maybe they're on a GLP-1 program in order to do that if they have significant weight to lose.
Yep.
But probably the most important thing is get that comprehensive lab and look at your hormones. Where are they? Mm-hmm. And then look at where your stress response is at, because, your body is pretty simple. When you think about how it's wired, we as humans, we're wired in a very primitive way.
Right.
We're wired to procreate the race or to fight off crisis.
Right.
So when you think of that, the hierarchy is, well, if I have to fight off crisis, I'm not going to worry about procreation of the race because I've got to fight a crisis off. That's the chronic stress of the day. An email, a text, being late for a appointment is not life or death, but it is perceived that way, and therefore people get into trouble with some of that sexual performance, desire, and just general circulation, blood flow, because they get stuck in that fight or flight response.
Well, and really, when you go back to it, I mean, you think about our ancestors, they